Watch Dr. Drew's new show at 9 on HLN. Weeknights on HLN.
Stephen DeAngelo joins me. He's the executive director of Harborside Health Clinic, and he is featured in the new television program Weed Wars. What's the war? What's the battle?
Well, the battle is to bring the truth about this important medicine to the American people. For many years, they've really only heard one side of the story. Now they're really going to have an opportunity to come into the world of medical cannabis and decide for themselves what they think about it.
So are we going to follow people in the clinic that come for specific medical purposes kind of thing?
Yeah, you know, the cameras came and embedded with us for a full year and just filmed everything that we did. I gave them complete and unfettered access to everything that we do.
Are you a physician?
No, I'm not.
Is there a physician in the clinic?
There's not. We maintain a strict firewall between physicians and dispensing cannabis. For the same reason you wouldn't want a pharmacy to recommend a doctor or to have a doctor recommend a pharmacy. You also don't want to have that kind of collusion between doctors and dispensaries.
No, I understand, but do they come with a prescription then?
Yes.
So a doctor prescribes it and then you guys dispense it?
The doctor recommends it. Prescription is a term of art. Prescriptions have to be filled by pharmacists, so doctors can't write prescriptions for medical cannabis.
I'm actually confused then. Aren't there cannabis dispensaries around town here that are run by doctors and nurses? Is that different than what you're doing?
That's different. Well, there's two things. First, you have doctors who are writing medical cannabis recommendations. There's many doctors who do that as part of their general practice. There's some medical cannabis specialists or pot docs who just do that with varying degrees of ethical behavior. They do not dispense.
I'm glad you said that, because in certain parts of town here, you could walk by and grab your prescription, not even slow down.
Right.
They don't do a medical evaluation. That's the part that bothers me most about all of this, that it's bad medicine.
Yeah. Well, the reason that I started Harborside was because I was concerned when I looked 5 years ago at the landscape of medical cannabis. I didn't think that anybody was really doing it in a way that truly was geared towards the patients. And so at Harborside, we've introduced a number of innovations to make it more health-oriented. We were the first dispensary to laboratory test all of our medicine. We actually had to start a laboratory to do that.
What's the most common diagnosis you're dealing with?
Well, chronic pain, chronic
cancer?
pain, anxiety, depression, insomnia would be the largest uses. We see cancer, we see HIV/AIDS, we see Graves' disease, we see various different types of multiple sclerosis, cerebral palsy. It's really all over the place, ranging from very, very grave illnesses to the kinds of things that Americans use millions and millions of prescriptions for, like, insomnia. And, as you know, like 15 million prescriptions are written for sleep issues every year in this country. So a lot of our patients see cannabis as a safer and more natural alternative to those types of pharmaceuticals.
And then they're followed by physicians afterwards?
Yes. They have to have their recommendations renewed at least once a year.
Once a year.
Before we accept a recommendation, we check with the Medical Board of California, make sure that that doctor's in good standing.
Let me ask about the medical board. The CMA has come out in favor of legalization. Do you guys have an opinion about the CMA's position?
Well, I don't. It's not my job to advocate for the legalization of cannabis.
You're just representing patients that want this.
Exactly.
This chemical.
I'm advocating for full access to medical cannabis for patients who need it.
What about people who just want to use it? Just want to get high?
Well, I think that a great deal of cannabis use can be accounted for by the wellness issues that I talked about, and that a lot of people who conceive of themselves as using it for recreational purposes are actually using it more for wellness purposes. I don't think that any psychoactive should be used for recreational purposes.
Stop there. Don't say any more. I agree with you.
Yeah.
that's good enough. I think we'll agree on that one.
Yeah.
I got to take a break. Thank you for joining us. I appreciate it. Very interesting. And we'll look for Weed Wars. Tell us the date and time again and where?
Thursdays at 10 o'clock. This Thursday you can catch it. Also the first episode at 9 o'clock along with the second episode at 10.
What network?
That's the Discovery Channel.
Discovery Channel. Okay.
And Health HLN.
Very good.